OCD stands for Obsessive Compulsive Disorder, and it is a psychological condition that's marked by obsessions, which are repeated intrusive thoughts, worries, ideas, fears that keep popping inside the brain and cause a lot of anxiety and distress. They're unwanted thoughts. The C part of OCD, the compulsions, are the behaviors that an individual engages in to make those thoughts go away and make the anxiety go away. What ends up happening with OCD is that individuals get caught in a cycle where they have the unwanted thought, they get real worried about it, they don't like it, it causes distress, they do the behavior, they get some degree of relief, only then to have the thought repeat itself and get stuck in having to do the behavior over and over again. OCD can start to take up a whole lot of time, get in the way of enjoying things, and really start to take hold and become negatively interfering, if you will, get in the way of functioning at an individual's best. Identifying the signs of OCD as a parent can in fact be tricky because some of the symptoms are in fact observable. So for example, if a child is taking excessively long showers or washing their hands repeatedly, or have other superstitions or rituals at nighttime, some of those behaviors are in fact observable. But then there are also some of the obsessional thinking, or even sometimes the hidden compulsions, the sticky thoughts where they're stuck in their head and they're trying to undo their thoughts in a way that's sort of what we might call mental compulsions or neutralizing. They're still compulsions because they're still behaviors aimed at getting rid of the thoughts, but they can sometimes be less overtly kind of observable. If things are taking an unusual amount of time, or if you are noticing that a child is engaging in a repeated behavior that seems nonsensical, or if you are hearing requests to do things in a certain way or to do them over and over again, even as a parent, these may be signs that there's some type of worry thought that is underneath it. So for example, nighttime, which tends to be a ripe time for OCD symptoms to be sort of more flared up. The goodnights, you might have a child that'll say, no, you have to say goodnight to me last, or you need to turn off my light and then you need to say goodnight. And oftentimes parents might sort of kind of do this, and then they notice that it's a pattern. They notice if they attempt to switch it up, it's more than just mildly irritating. It can be incredibly distressing. So what I will tell parents is not every routine means your child has OCD, or not every question or request, or frankly, even a shower that one time might take a little bit longer, that doesn't mean it's OCD. It's a pattern of behavior. And it's when you start to notice that some of these repeated behaviors or the distress associated with their thoughts or complaints about sticky or unwanted thoughts are increasing, these might be signs that there may be a diagnosis of OCD that needs to be looked at further. So the first step in addressing OCD is to get a good, solid assessment. And what that means is identifying an anxiety and OCD expert, setting up an interview and a clinical assessment that will involve getting information both from parents and then also from the child, of course, and coming together to see if in fact your child is meeting criteria for OCD. If there's a diagnosis of OCD, then the next step would be to get evidence-based treatment for the OCD. The evidence-based treatment for OCD is cognitive behavioral therapy, and specifically exposure and response prevention, or for short, CBT and ERP. And what that treatment is, it's basically an effort to break the cycle of the OCD, to help the child learn to tolerate some of these unwanted thoughts, some of these scary thoughts, embarrassing thoughts, and to resist the urge to engage in the compulsive behavior. So, what we'll tell families is it's practice facing fears and preventing compulsions or resisting compulsions, riding the wave of the anxiety and letting it pass on its own without, in a panicked way, trying to make the thought go away. In fact, one of the important things to know in treating OCD is that we're not trying to make the thoughts go away. We're trying to learn how to respond to them differently. Parenting a child with OCD can be really tricky because a lot of the times parents are unknowingly part of the OCD rituals, whether it's responding to the requests of the OCD, whether it's providing reassurance. And in order to help the child overcome his or her OCD, we have to sort of rework that a little bit. We need to help parents empower their child to tolerate the anxiety, which can be hard as a parent as well, and not, for lack of a better way of saying it, give into the OCD. Now, that can be done with a great deal of empathy. I see this is really hard for you, but I'm on your team, not the OCD's team. So we're going to fight this. We're going to resist the urge. We're going to take that short shower, or we're not going to do the good luck, bad luck rituals. And I know it's going to feel really, really challenging, and I know you can do it. But it can be so difficult for the parent, right? Because to see a child in such distress often will pull on a parent's doubt. Am I doing the right thing? It seems like things are getting worse. And so a lot of the work that we do in working with children and their parents in OCD treatment is normalizing that as part of the treatment. So the individual and the child is going to learn strategies, and depending on the degree to which the parents may be part of the rituals, accidentally part of the rituals, they will need to play to varying degrees a role in that treatment. And it doesn't mean it's parents' fault, and it doesn't mean that parents have made it all worse. It's just parents are part of the solution, and it's not always easy.